Hi, everyone. My name is Dr. Nate Ritter. I'm Good Dog's Medical Director. Thank you so much for joining us today for our presentation on tackling infertility in breeding females with our guest, Dr. Andrea Hesser. I wanted to share a quick overview of what we'll be focusing on today. We'll learn from Dr. Hesser about the most common ailments in canine breeding programs that affect conception and carriage of pregnancy, including diagnosis and treatment options. We're so excited to partner with Purina again to bring you this Good Breeder webinar. This was a topic requested by our community, so thank you for letting us know what you'd like to see more of in terms of canine health content, and please continue sending suggestions our way. We hope this will be helpful for all of you and your breeding programs. We've already hosted a ton of webinars this year, so I wanted to remind everyone that you can always find all recordings in the Good Breeder Center at the link we'll drop in the chat. During the Q&A segment of this presentation, we'll be prioritizing the previously submitted questions from our community first. But if you would like to ask any questions, please feel free to drop them in the Q&A box at the bottom of our screen, and we'll do our best to answer them. Before we kick things off, I wanted to share a little more information about Good Dog for anyone new who's joining. Good Dog is on a mission to build a better world for our dogs and the people who love them by advocating for dog breeders, educating the public, and promoting canine health and responsible dog ownership. We're a secure online community created just for responsible dog breeders to connect with serious quality Good Dog applicants and find forever homes for your pups. We use the power of technology to help our good breeders level up their breeding programs by providing them with tools like our secure payment system to protect them from scams and our best-in-class software to post available litters and start connecting with Good Dog applicants, as well as a number of free educational resources and health-related discounts to help your breeding programs thrive. If you aren't a member of our community, we invite you to learn more about our mission and apply to join at www.gooddog.com/join. And before we get this presentation started, I wanted to share a little bit more about Dr. Hesser and her amazing background in canine health. Andrea Hesser, DVM DACT, is a board-certified reproductive veterinarian who practices in small animal medicine in the Dallas-Fort Worth area. Her clinical time is spent doing general practice veterinary medicine and reproductive consultations and surgery. Dr. Hesser also provides semen collection and health testing services at local dog shows. She's a longtime canine breeder and enthusiast with an interest in whippets and bull mastiffs. Her mission is to serve breeders by helping them achieve their goals with their breeding programs. With that, I will pass it off to you, Dr. Hesser, to get this presentation started.
Okay, there we go. Sorry, you guys, if you couldn't hear me. So I thought I unmuted myself. So thank you guys for being here. I apologize. I just noticed my slide here says that it's yesterday. So it is June 18th if you're having a double take. So we'll be talking today about infertility in female dogs. So there's this is a large amount of consultations that I see. Certainly it's always one of those scenarios, we always have, there's two pieces of the puzzle, right? There's the dam and the sire if they produce a litter, but if they don't, it's kind of a who is at fault. And I think a lot of the times the fingers get pointed at the stud dog because it's just common, but there's two components to that, and I think a lot of the issues happen on her end some of the times. Sometimes it's a combination of things. So I think it's good to kind of review what things we know are out there in dogs, and just give you guys some tools as far as what could be pursued if you wanted to pursue working up a dog that was really important to your program that might take a little bit more effort to get pregnant or to carry pregnancy. But I know some of you guys want an update on Zest, right? So some of you guys were around for the last, I don't know, probably 6 months or so. You've watched the saga of my bull mastiff's pregnancy, some of the loss related to that pregnancy, and trying to rehab this puppy into a more functional puppy. So I just wanted to let you guys know she's still at my house. She's still doing great. I am hanging on to her. I went ahead and sent off her genetics. She is getting around well on her legs. She's not ever going to have a normal stifle or a normal knee. I didn't put any updated x-rays on here, but basically she has some range of motion to her knee. She still reverts to using her leg kind of like how she's trained her mind to. So she tends to use her leg in a very straight fashion. At this point, we've kind of met our end with trying to do that flexion procedure that we talked about. So the procedure where we were trying to make her knee bend under anesthesia. the surgeons basically said at some point she's going to be stronger than us, and that's where we are. So she could have, in theory, could have like a surgery to try to free that up as well. But I think it's one of those, it's kind of experimental. We don't really know if she would respond well to it. She could scar back down from where she was, depending on how she did in rehab. So I think I'm happy with her, with her using it regularly. She puts weight on it, she runs around on it, she's fully active at home and has no pain, no issues. So we're calling that a win. So I think over time, as I know there's some other presentations that I'll do periodically for these guys, and I'll keep giving you little updates, but she's she is 14 weeks old this week. But she's about 30 to 35 pounds now, and just all vinegar. She's just wild. You can see Finn there, my whippet, is like, I will hide this treat up here in my couch because you are crazy. All right, so we're going to talk about infertility, what it means. So you can certainly have infertility at different points, or poor carriage of pregnancy at different points. Some of the time it's things at conception. Sometimes it's uterine problems. Sometimes they're resorbing or having loss in other ways. They can have a number of different diseases that can contribute to that, one of which you guys are experts on now. So Neospora is on that list. Strategies for infertility. So if you are kind of in that boat and you feel like you have a dog that kind of qualifies to work up, and then I'm going to talk a little bit, just if we have time, on some optimization for the breeding program approach in general. So just like basic husbandry things that are just going to promote you getting the best results you can on the female side. And if we have some time, maybe talk about some cases. I'll probably just work the cases in as we go. So, true infertility, when I'm thinking about it, is when she doesn't conceive. So whenever she is unable to actually kind of, if for egg to fuse to sperm, for that to become an embryo, for that embryo to adhere to the uterine lining. Conception in dogs is defined from, well, it's basically from the period where, like, immediately post breeding. It's not going to necessarily be the day of breeding, right? So sperm takes some time to make their way through the tract. The eggs aren't always ready at that time, but once egg and sperm are both mature and in the right environment on the right date, from that date to about 19 days, so 19 days post LH is what we're talking, we think of as basically a medical dead zone for dogs. So we can't tell you if she got pregnant, right? So like a person, we have EPTs, you can pee on a stick and you can know in relevance of timeline. We're talking in dogs where it's only a 65-day gestation length, right? So basically the entire first trimester for the dog, we can't even tell that they're pregnant. Even with a really, really nice ultrasound, 19 days post LH, we can see what we think are like almost like cysts. So we call them vesicles, but they're very, very tiny, like millimeters wide, small circular kind of dots, if you will, in the uterine lumen. But it's not something I would recommend for my personal clients. We're talking like human grade ultrasounds can find it. I usually say 21 is pushing it. There are some dogs we've been able to check as early as 21 days post LH in kind of some of these weird scenarios, but it's tough because then what do we, if the in the first trimester in a human, that's when we experience the most loss. So there's probably a lot of dogs that we just can't document exactly why they weren't pregnant. But they did try. Maybe they got to 10 days and then they resorbed, or the fetuses didn't, or the embryos didn't stick very well, or something to that effect. So why don't we have an EPT for dogs? It would be great, right? If we had like something where you could run a test at 5 days post breeding and you could know, did she conceive? Because we basically have that in people. So in dogs, so the purpose of the wolf here. So wolves they are pack animals. We say that dogs and wolves obviously have a lot of common genetics, dogs having descended from them or from similar canids. So wolves existed in a structure where they would have an alpha female that would carry litters, and the rest of the pack would not necessarily be bred, but they would cycle, and they would cycle, go through their process in the exact same way as a non-pregnant dog as the pregnant dog. So the pregnant wolf and the non-pregnant wolf would both cycle, and the idea was if their cyclicity was kind of at the same time frame, they all kind of came in at the same time or had the kennel effect, is what we call it in dogs. And then they go through a similar cascade of LH peak, progesterone, having ovulation, etc., and then going into a low progesterone state after having that. It creates the effect of those other wolves being able to lactate for this alpha female. So there are some endocrinologists that I know, so people that were like the people that really study progesterone in dogs at a high level, that really think that dogs don't have any recognition of pregnancy because their body, no matter what happened to them during their cycle, goes through the same thing. So it doesn't have to tell its own body, keep this pregnancy. It already will do that by design if they're bred and if they get pregnant. In other species, what happens, let me see if I can, I don't think, not sure if you can see my cursor, but so if you can, great. If you can't, I'll just try to talk you through it. So if the progesterone is climbing and it's going up and going up and going up, and maybe there was something here in another species where we started to go up, but she doesn't get pregnant or she loses her pregnancy. Well, a lot of other species, their hormones go down. So they'd start to climb and then they go back down if they didn't get pregnant, either progesterone or another endogenous hormone. There's other species have early recognition factors that happen at different periods. So if we had that kind of scenario, well, in some species, they just go right back into cycle, right? So things like cats, if she doesn't get pregnant and her progesterone doesn't go up, she just goes back out of heat for about a week and then she'll come back in heat. So it's a very different, just a very different dynamic for the way that they function. So in that first 19 days post LH, there's a few different things that we kind of break down. Again, this is all theoretical because we can't prove what happened when, but just to give you some perspective on what should be happening in their body that we know does happen, but we can't define on a from an ultrasound perspective. So we can't tell what's going on. Microscopically, they've been able to look at some of this with like electron microscopy, for example, but it's really tiny stuff, way tinier than what we can see. So from LH to fertilization, or that kind of window where we're doing our breeding work, we could have failed fertility based on simply breeding and timing. So did this stud dog have the right sperm in the right place at the right time? Are those sperm and eggs happy to go through the process to make a zygote and produce an embryo? Did they not for some reason? And then like once that period happens, well, once fertilization happens, we have something to work with. We're going forward with an embryo. From there to implantation, which is about 12 days gestation when they implant, we're thinking uterine health. So when those babies that are starting to form in the oviduct, so they're way up high, they're not in the uterus yet, the oviductal embryos will float down into the uterus and they'll kind of float around between 6 and 12 days. They'll float from horn to horn. They kind of like find their own space. So sometimes when they're migrating around, maybe they get stuck around in a spot that's not super healthy, or maybe they didn't lay down a really good placenta for themselves, or the kind of foundations of a placenta. They started to kind of have some hiccups with where they were. That's kind of that time frame. Again, we can't see it with ultrasound or traditional means, but that implantation is just like the moment where this puppy decided to be here, so they can no longer kind of bounce around and float around to find a good spot. From implantation at 12-ish days to ultrasound visibility, they can also just not grow where they landed, right? So if they say they landed on a cyst in the uterus and they stuck to the wall, but it was kind of right next to a cyst and they're trying to get blood supply, well, a cyst isn't going to have very good blood supply if it's kind of blocking out where they can get some of that nutrition from their mom. So that could happen. Also just things like maybe like chromosomal type defects. There might be some stages where some things that just happened in nature did not want to go forward in a healthy way, and sometimes they'll lose puppies that way. They also can lose puppies at this stage. This is a stage where a lot of infectious things can happen, right? There's lots of blood flow to your uterus. They're really young and fragile at this point, and it's just like I said, it's just hard for us to confirm, did this really happen or not at this stage. So I know you guys probably already know the answer to this, but the number one reason for infertility is, I wish I had one of those like little drum roll sound effects, is poor breeding management. So I would say 95% of consultations that I see, I will go through the history with them and we'll talk about things that can be improved. But almost always I will encourage people to say, you know, if we bred without ovulation timing, if we bred to a stud dog with maybe iffy semen, if she had funny things with her cycle, if she wasn't followed out because you were traveling to your stud dog and we don't know exactly when she ovulated, but we went ahead and bred her. Like there's lots of those types of things that I think we like to give them the benefit of the doubt and presume that we did things right because we're trying to do things as best we can. But sometimes we can't work all of those details out. Sometimes the lab's closed. I mean, my example with my own dog, had I not had the access to multiple clinics to run progesterones, my progesterones all got lost in the mail when I was breeding my own bitch this spring, right? So I ended up running them twice. Fortunately, I had a friend down the street who said, come bring all your samples. I saved a bunch of samples in my freezer. So I like Hail Married that scenario, but those kind of things can certainly happen. If my bitch had not gotten pregnant, well, I mean, you can't fault that necessarily as a true strike against her having a fertility issue. All right, so I know we kind of talked through some of these things, but they can have problems of different kinds at different stages. So we'll just talk a little bit about each of those just as an overview so you guys have a list in your mind. Conception, like we discussed, could be semen timing, could be something to do with her cycle, how it went through, maybe the technique used. So did we use, like I've got a good friend of mine who's a good example of, she has a 5 or 6 year old Borbal bitch who's wonderful and she's a really good contributor for this breed. If we can get her pregnant, she's never gotten her pregnant because she's just had something happen. Each time they've bred, they've had something happen. So one of the times she bred, they tried to do a natural breeding and they ended up doing a vaginal AI. Well, vaginal AI in a giant breed dog is it's a much harder feat. Sometimes it just doesn't have good outcomes. I think it's a breed specific thing. I don't fault the Borbal bitch for not getting pregnant from a vaginal insemination. They wonder if they were a little late. They had to run progesterones at 2 different places. She went to their national. You know, it was just one of those things where everything didn't work the way it needed to go on that particular cycle. And sometimes those things happen. They also can have just incompatibility. So there are some stud dogs and some females. When you combine dog A with dog B, dog A and dog B do not get pregnant with each other. You breed dog A to dog C, and she'll get pregnant. And you breed that stud dog to a different female, and they'll get pregnant. But for some reason, you keep trying that same stud dog and you might not get a good outcome. So sometimes we might say, I know this is what you'd prefer if you're going forward to try to get your infertility kind of concern female pregnant. We might say, would you rather have a puppy from this female, or would you rather have a puppy and sacrifice the potential that she won't get, potentially she won't get pregnant if we keep trying the same stud dog that's the ideal dog, that's the only really dog that you have in your head. I think a lot of people, it's a tough pill to swallow when we get to that kind of discussion, but sometimes repeating the same dog over and over and over is its own kind of hole to dig. All right, so I know you guys already kind of saw the same graph. So just as a reminder, so there's different stages of when things happen with the canine cycle. We can breed them outside of this fertile window. So the fertile period here, this is post the days at the bottom are post LH. 7 is probably pushing it, but I would include it as part of like frozen semen, or if you were doing intrauterine breeding with either a TCI or surgical breeding, sometimes even natural breeding at that far post ovulation. So it would be day 5 post ovulation. It's pushing it, but they are the oocytes or the eggs are fertile usually in young, healthy, reasonably young, healthy bitches. We can't get the semen to them sometimes at that late, but technically they can conceive. And we do see a lot of dogs that have good conception rates with that. But we're waiting until, a few days post ovulation before we really see that fertility window spike. Now, can she have a really fertile dog with fresh semen breed her way back at -5 and have a pregnancy? Absolutely. We see it all the time. My personal record is 73 days post TCI with fresh semen with a singleton. And I used to say 72 was the extreme on the furthest out it could be. But from natural breeding, there's a lot of variety. From fresh semen breeding, there's a lot of variety. Even if you're doing your own fresh AIs at home, say, and you didn't have the timing or you didn't trust the timing, something was weird with the timing. I think, things to be considering. So there is this thing that's called an anovulatory cycle that can happen. So normally progesterone goes up and it continues to climb. It might not climb really aggressively. I mean, some dogs don't have a really pretty trend like the graph, but there are some dogs that go up and they sit and then they come back down. This is going to look identical to a split heat. So some dogs will do this and spend a lot of your money doing progesterones, and then they'll go out of season, and then 4 weeks later they'll be back in season, go through a cycle, and ovulate. Other dogs will do this serially every time they cycle, and I will tell you, this is one of the most frustrating conditions to fix. For those of you guys that are attending that this was like your hot button. I've seen this in my lines. I think it has a genetic component. I think some breeds like to do this, and I think it does have to do with some lines, but truly, there are ways we can try to fix it. Hormonally, we can. The cycle, when it's happening in front of you, by the time we figure out she's doing this, and see the trend not going and not going and not going, we let that trend go for a little while. But by the time they do stall for enough time that we say they're definitely stalling, their egg health, so the actual health of those oocytes or eggs that haven't ovulated yet at these numbers, those start to get real, I would just say, just poor quality once they ovulate, that we think that the eggs themselves are just not happy on this cycle. So I usually recommend, if this happens, if it's a recurrent problem, for sure, then don't breed her necessarily or throw a lot of money into her at this cycle. I would recommend next cycle to purposely force her to ovulate with drugs. So there are some drugs that we can use. There's a few different hormonal injectable drugs that people will use. Lots of different studies that have different protocols. So I won't go into a specific protocol here, but there are some kind of combined GnRH and HCG type injectable protocols that have been successful. I will tell you, in my personal experience, these are very challenging to fix. And German Shepherds especially, very challenging to fix. If they have this once, I would just presume she's having a split heat. They can't have a split heat anytime. That just means that they're doing that. They're going to have this little rise, and then they go back out, and then they go forward another, in a month or so in another subsequent cycle. But it's not good for them to kind of keep doing this and keep doing this and keep doing this. I think that's part of the issue of why we can't get these pregnant sometimes. Sometimes we can't make their cycles go forward. Sometimes we can make their cycles go forward, but this, like, sitting with low progesterones and having regular, like, frequent cycles that aren't doing anything, it primes your uterus to be super unhappy. So it makes that estrogen that's kind of coming and going with these cycles, if they're kind of not cycling in long intervals like a normal cyclic heat would, it can just be a recipe for problems. So just as a reminder, so if we're talking about confirming when she ovulated, so in reference to these numbers, you can see she goes up, 0.4, then a couple days later 2.5, a couple days later 5.3, Then she goes down to 3.5. Usually, if they start doing this, I'll look at a cytology at for sure as part of this to say like, what is she doing? She can putz around at 5.3, 3.5. Some machines, I mean, there's some variability that can happen. They don't have to go up in a steady line. Sometimes they kind of do some funny things, but for classical purposes, we want to see a 3 nanogram per mil rise. So 3-point rise if you're in the United States. That's the measurements we use. If you're in Canada or overseas from the US, you might be using nanomoles per mil, and that'll be a little bit different trend. I don't know what the conversion factor would be for that, but I can look it up. If anybody is interested in that, we probably can get that information for you posted. So we want to see 3 nanograms per mil in 24 hours. Well, for most people, I would say how most veterinarians are timing and recommending, and because most owners are reluctant to be running daily progesterones for a lot of their breedings, we might not see specifically when she did this 3 nanogram per mil rise. But say if you checked her today and she was a 6 and she was a 12 on Friday, well, she's definitely ovulated, right? Like we know that trend. We can't prove it, but like there's a pretty big jump there, and we can presume that she did something in there. Did she do it on the day she was a 6, or did she sit at 6 for another day and then she ovulated off of a 6? That's also possible. The old rule of 5, a lot of machines will, I would say 4 or 5 is like I'd say it's like 90% of dogs will ovulate off of those types of numbers, but they don't all do it, right? So like this dog, well, there's plenty of people who would have done 0.4, 2.5, 5.3, and then they would have just planned to breed her. There's lots of very good veterinarians, I hate to say that, but lots of good veterinarians that are my colleagues that I wouldn't do the timing in the same way, but that don't follow them after they hit roughly ovulatory ranges. They might, some vets will maybe run progesterone the day they bred, but I'm more interested, like after this 5.3, I want to know what she did after that before I plan for when I'm breeding her, because it'll give me more specificity. So if they're greater than 10, though, we know that they've ovulated. At that point, they're high enough. They have to have. Some dogs will sit there and go, sorry if you're that owner, but they'll go 4, 5, 6, 7, 8, 9, 10, 12, that dog, or the 4, 5, 6, 7, 7, 7, 7, 7, 8, 7, 7, 7 dog that carries their pregnancy and somehow went through the motions. They really can do a lot of different things. Sometimes it can be hard to interpret. All right, so I know we talked about oocyte quality or egg quality in relevance to holding onto your eggs too long. So if you don't ovulate and they sit there and sit there and sit there and finally they ovulate, well, sometimes they're not super healthy. They also just can be unhealthy. So this is a common issue with older dogs. This is why we think so there's kind of twofold reasons why older dogs don't like to get pregnant. Dogs cycle forever. So they do not have menopause like women. That is a total it's a totally different type of cyclicity than what we're dealing with dogs. Dogs will cycle until they die, for the most part. The reason they might not cycle is pathology or having an issue, such as or an ovarian tumor, something functionally going on. Their ovaries and uterus never actually shut down completely. But they don't make very healthy eggs when they're older, and sometimes their uterine health is the other reason. But I would say the association, the younger they are, the healthier their oocytes and embryos tend to be. So, so sometimes we don't get to know all the information. So, semen quality, we love to know. So we talk about this sometimes when we're planning for infertility scenarios with maybe they have a young stud dog that they have naturally bred, and it's been 6 months since he had a litter of puppies, and he's really hard to collect in the clinic, but you can get a natural breeding on him. It's one of those kind of question mark scenarios. So do we try to collect him to do something artificial so that we can physically see what's going on in there as part of the cycle? Or do we just leave it well alone and say natural breeding is fine? Well, if she doesn't get pregnant and all we did was natural, did he have good sperm at that time? And I think we have to presume a little bit. I think if he's being bred on either side of that, you can pretty well rest on that he's probably okay. And maybe it's a combined, male and female issue. Maybe it's just on her end as to why it didn't work, or, the things we just visited about, the actual timing and things. Um, the only way, even with semen evaluation, though, like if I did evaluate the semen and do a TCI, and it's a novice male, never been bred before, maybe he's got something, some DNA damage or something that's not showing up on his motility. His motility looks good, his numbers look good, his morphology looks fine. We use those things as an indirect way to say he looks fine, but the only way to prove that he is fine is that he produced a litter. Because there's a lot of little microscopic things that have to happen. Sometimes those show up as red, flags in the semen evaluation. Sometimes they don't. And there's some dogs that always looked fine that had a flagellar problem. There's some kind of unusual tests that we can run that are not super well studied, but there's some kind of odds and ends stuff that we can look at that has to do with mostly DNA damage and oxidative stress in sperm. But basically, the sperm isn't healthy, even though it looks like it's okay. It's not as healthy as it looks. So again, this is kind of a given. What was the count like? Were we happy with the motility? Were we happy with the morphology? Did we run a semen eval? Because sometimes it's, and that's okay. I mean, sometimes it's, well, I do my own AIs, at home, and I always have good success, and that's okay. I think I don't hold that against her necessarily if we didn't have really complete data. And I will say a ton of times people look at concentration. So they'll see this sample in the center and they'll say, oh yeah, it was super concentrated. This is fractionated, by the way. So there's clear on either side. That if that was all combined, that's typically what the owner would see in their bag, right? So more volume than what you see. He's super concentrated in this picture. But they might say, oh yeah, it was a ton. He gave us a ton of sperm, and I'm not worried about that. And yeah, I looked at it under the microscope and it was super, super modal. Did you do a morphology? Well, no. I had a breeder, a Labrador breeder, and a lot of you guys that have labs. It's very common for the Labrador community to ship semen to each other without a veterinarian, which is fine. As long as things are going well and the both parties are cool with that, as far as not having complete morphologies and more specific data. I mean, you only have what you can work with at your own home, so some people don't have as much equipment, but it's expensive, right, to be doing all this and miss a bitch on a cycle. I had a breeder that said, I have this dog, he's like 7 and he's awesome, and he collects a ton of sperm and it's super modal. And sure enough, she just said, I've been shipping semen on him and nothing's getting pregnant. I'm shipping all this chilled on him and I don't know what's going on. I haven't bred him in like a year, but something like that for a history. Well, we brought him into the clinic and he's got like 95% proximal droplets. He's 95% modal and he's producing 1.5 billion sperm, and he's super easy to collect. And I'm sure it chilled super well. But if you have some defects that you don't see at a distance, like at a low magnification or just at the motility sample, you might miss a very clear reason. That's a really clear cause and effect. That stud dog, those female dogs did not miss because they had an issue. Those owners don't need to be worried on their end. It was all him, and we can confirm that kind of after the fact and presume that that's what was going on. So just as a mention, there is sometimes we might, if we think that we're really struggling to get something pregnant, there are some stud dogs, and you guys might own some of these dogs. You are very lucky if you do. There are some stud dogs that just flat out have an it factor, and I cannot explain it, but they are just good at getting things pregnant. And if you are really struggling to get something pregnant that is important, again, sometimes you have to sacrifice which dog you wanted to use, but sometimes there are just some dogs that just don't miss very often. They're stud dogs, and that are good natural breeders and vigorous breeders, and like know their job and always get things pregnant. And I think some of us are, it might not be something a lot of information on when you're looking at dog options, but that's something to consider. Like if you had something at home that you're like, well, he's not really right for her, but he always gets things pregnant and he has a litter on the ground that I have right now and I love them, I use that dog. I mean, that is a really good approach to improving your outcomes. Okay, so I know we alluded to some of these things, but just to review, so there's a lot of different things you can use to improve the timing to make sure that everything's proper, and that you did everything you possibly could. So cytology is one approach. So if they have kind of that weird crummy looking cytology, if I see a ton of kind of debris and stuff that really shouldn't be there at the stage that they're at, it might give me some clues as to, like, is she progressing like she should? Are we happy with how she went through her cytology? Progesterone, we've already talked about, we track, as well as LH. In some cases, I think LH just gives you another backup point to say, like, we know what she did and what day she did what she did, and we know what day we put semen in her. Vaginoscopy can help, I think, sometimes from a diagnostic perspective. Sometimes we see like discharge visually, like when we're doing this is with a TCI scope. So both of these images are TCI scopes. They show different stages. So the top one shows kind of a pinker, smoother appearance that we'd see earlier in a cycle. The bottom is more what we'd expect to see when she's ready to be bred. If that doesn't look right when it should, I will tell that owner when we're doing their TCI, she's not crenulated, or she's not progressing in the way that she should look on her TCI scope. And that is a red flag for me that she doesn't want to, that she's having issues with the cycle. There's something weird going on with the cycle. So I know this is all like weighing money to some extent, right? So if you're in the office and I've got a weird feeling about what she's doing, and she never really crenulated, and you've got some irreplaceable semen from 1975 that you imported from Scotland that you cannot get back, I might, if it was me and there was unlimited funds and there was a backup option for stud dog, I would breed her to a different stud dog that cycle. If you had it available, leave that frozen semen alone, and take, I think, take the position of, if that things don't match and things don't progress visually the way that they should, it's a red flag that hormonally, even if on paper she looked like she did what she should, something is not connecting the dots properly, and she might not go through and get pregnant. Not always true. We breed plenty of dogs that are kind of slick and not appearing like they should with fresh or frozen or chilled semen, but it's just more things to consider in the long run. So, and then behavior, certainly, I think behavior for me, sometimes it can indicate it's just helpful for like reinforcing that we felt like the timing was good. I don't think it's like the crux of what you need to focus on, but it's just good information to know kind of what she was doing. It could make absolutely no relevance to the the situation that she's at hormonally. It could be just temperament, the interaction of the two dogs. Sometimes some dogs just um, cannot be kind of put together and expected to perform with one another depending on their temperaments, the breed. Some breeds, like, it really makes no difference because we're doing lots of side-by-side type approaches, and they might not have like appropriate libido like other breeds where we rely a lot on natural cover. Okay, so just to review, so I know we talked about this. So this is actually where she conceives. It's way up in the oviducts. We're doing vaginal inseminations way down here. So it's asking a lot of things to swim, right? So some of that is her body is moving the sperm too. So it's not just relying on the tail of the swimmer. But I think, it makes sense that, especially giant breed dogs, that we're not going to see as much. They've got to travel a long way to get where they're going, and it might not go as smoothly as, say, toy breed dogs, where we have a lot more success with vaginal insemination. TCIs and natural breedings, we're going to end up with semen basically in the body of the uterus and filling the uterine lumen. Surgical insemination, it's not really in a different spot. It's just where I put my my needles and my catheters is going to be at the base of each uterine horn. The idea is we end up filling the uterus again. We fill the space, but I like to place those there, and that way I can kind of control things a little bit better in surgery. So this is old data from Josie Ranch, just so you know. Josie Ranch is a practice in my area that I used to work at. And so this is their kind of in-house data, which is excellent result-wise. So in general, we don't see a tremendous amount of difference. Oh gosh, and this is Ridgeback specific. Hang on. This is Ridgeback specific. I'm sorry, you guys. I pulled this off of the wrong presentation, but it gives you some perspective. So we'll use Ridgebacks as an example. They do have kind of an overall view of that, and you guys might see they usually provide those numbers. They got them on little stickies in case you guys use them, um, but vaginal. So for this breed, you know, it's not a giant breed dog. Vaginal insemination is pretty successful. TCI a little bit better for fresh and for chilled. We don't do vaginal with frozen, obviously. The kind of approach with frozen, they do get pregnant a little bit more frequently in this. So in the TCAI, which is the TCI column, the first number is 1, the second number is 2. So if we did 2 breedings, depending on the cycle, fresh and chilled, we might be doing them a couple days apart. Frozen, we're going to be doing 2 kind of at either 4 and 5, 3 and 4 post ovulation, or 4 and 5 post ovulation. So slightly better, maybe 5% better outcomes, few percent better outcomes when you have a little bit more like you have 2 inseminations versus 1. Well, it might be that we overcame some of those semen concerns, right? Like if we didn't have enough numbers, maybe the timing wasn't quite right. So that second breeding sometimes gives you that advantage. Surgery, we are not able to do a second one. There's not a way for us to have teased out. There's some dogs that also get a TCI and a surgical. Those dogs, I don't think they were teased out for data for this purpose, but just to give you some perspective, this is in a very successful practice, a very good practice that is doing very good quality reproductive care. This is the type of outcome that you'd love to see. There are some like studies out there that have more specific data, especially for frozen now, for TCI versus surgical and things. They're going to have different data points and numbers. It's different numbers of dogs. So this is a really healthy, like for this is 3,500. This is over like 20 years, I think, but 3,500 Ridgebacks, individually just Ridgebacks that are included in this data. So it's pretty strong. And I think, like I said, I think you can optimize when you're approaching infertility. We want to optimize with the best technique, the best approach. Sometimes your vet might have this types of suggestions. So if they say, well, we feel like we get more things pregnant with surgical than we do with TCI, follow what their feeling is clinically. I might have a different clinical opinion and have a different approach than another veterinarian, and that's okay. I think like in this clinic, and I'll speak for them because I used to work there, like I said, but at this clinic, we're very pro TCI because our TCI results are better than our surgical results. So like we just go away based on what the trends are medically and what is out there medically, and try to improve ourselves and make ourselves the best clinic that we can. I think that's what any of us are kind of trying to do in medicine. So, all right. So other mentions. So I know we already kind of beat this to death, but we have different success rates with different procedures. So we don't expect, you know, a dog that a boar bull that has a vaginal insemination. Well, that might be the reason why she didn't get pregnant. Just as simple as that. Sometimes, like I just mentioned, how comfortable was the vet? If they're just learning how to do TCI, maybe they don't do a TCI for your infertile kind of end of the road, this is my last heat cycle that we can try because she's 6 years old situation. Or maybe you travel. And I think just being honest with us, like, we don't mind if you go somewhere else. We absolutely don't mind. We understand if there's like something that makes more sense. We want your dog to be pregnant. So just a short mention, you guys might have already seen this data, so I'll just briefly touch on it. I know this was something that came out, you know, a little while ago. This was probably 5 years ago, but they did this study in Dandy Denmonts, and they said, if we disregard physical choice of the dog and we say we need more genetic diversity, there is proof, with at least within Dandy Denmonts, they basically documented that if they selected purely they ran a genetic panel and they said these are the most genetically different from each other dogs, those 2 dogs would end up producing an extra puppy in the grand scheme, like when they ran the stats on it. an extra puppy would be born, which in this breed, 1 or 2 puppies can be a very successful outcome. They're very difficult to get pregnant. They're very rare as a breed. And I think the concern is, are we going to lose the breed overall because there's just not enough of them left? And we want to make sure that we have them going forward. So I think the breed club showed some interest, and they did this study. Maybe it's been probably 5 or 7 years or so, but there is something to do with inbreeding coefficients, or how tightly they are bred to one another, can impact your litter size. We know that there's some like, we appreciate that, right? Like, you're not supposed to marry your cousin, but like, we breed cousins and dogs all the time, right? Like, we're not as worried about how close they are. They're all relatives because we've selected them for very specific features. And the way that we got Dandy Denmonts in some regard, every breed, we said, this is, well, for most breeds, I would say maybe not the breeds that are like really developed in a wild state, things like African bred dogs and things of that nature. But a lot of these breeds, we said, well, we love this dog and we're going to strongly line breed on this pedigree on this particular stud dog and have him in the background of the pedigree and try to like kind of keep him on to that whole kind of mission going forward and try to keep his line kind of tight. We produce a very consistent dog. That's what purebred dogs are. They are, similar bred to similar, that went forward generationally and then became a little bit more narrow genetically. And that's why they're different from, why Dandies don't look like Labradors, because we selected for their traits. But by doing that, we also narrowed their genetics. When you have a really small pool of genetics, you kind of get yourself backed into a corner where everybody's related. And certainly like bottlenecking and popular stud dog syndrome, it could be a big problem for some of these guys. So I say all that in the effort to say there's not technology to prove this. So what they showed in the Dandy study, they had some of the breeders that were involved. They said, which of these, give us some stud dogs you like, and we will run the panel on a genetic panel, and then we can show you which ones are most genetically different. What they thought they would find based on the inbreeding the traditional pedigree-based inbreeding coefficients did not necessarily match how diverse that dog was from the other. So, if you breed your 2 dogs today, some of those offspring might have had a lot more genetics picked up from the sire, and some of them might have picked up a lot more genetics from the dam. But we go forward with them mathematically and say that it's 50-50, and it's not. So what they found was, like, I think the 2 dogs that this particular Dandy was looking between, there was a dog the people were in like Pennsylvania. There was a dog in California, which they presumed would be more genetically similar because they were both United States bred recently, like from the pedigrees. They were both kind of from the US Dandies with more closely related pedigrees. And then there was a dog in like Russia. The dog in Russia was actually, they thought for sure that would be more genetically diverse, and it wasn't. The dog in California was actually the better match for that dog in Pennsylvania. So I think there's a lot that hopefully we will have more genetic testing at like low cost. And some species we have really cool, like they can, take a sample and run all sorts of predictive factors for things like the livestock industry. We use this all the time for like dairy cattle, for example, for predicting what you want to select in your offspring and how to go about kind of going forward with the breeding. All right, so we're going to shift and talk about some uterine problems now. Once we're kind of past the early stages of things, we then have to focus on, okay, what is happening when the embryo attaches to the uterus? Is everything going forward properly, and is everything happy? I think there's a number, but the most common ones we see, cystic change. So the cysts on the inside of the uterus, not on the outside of the uterus. Inflammation. So some dogs just have an overactive inflammatory process that happens in the tissue. It's not something you can see from the outside. She'll act totally fine, but we think that that's quite frequent. I would say that is like, of some of these girls that we work up, that is super common as an outcome. If we don't find any findings, I think that's usually like low-level inflammation is usually my biggest suspect. They can have an infection, so they don't have to have a pyometra to have an infection. So this is really well studied and well understood more in mares than it is in horses than in dogs. Um, I think we're kind of scratching the surface on dogs. I think that traditionally a lot of people just kind of blanket treated with antibiotics, which we know it's not ideal to be doing that. But also vaginal cultures are not really the way that we go anymore. I think we can sample things in the uterus, which we'll talk a little bit about later. They can have fibrosis, which just means like they lay down extra kind of scar tissue in between all of the little kind of components of the uterus, the cells in the uterus that are supposed to provide nutrition to these embryos whenever they attach. There are kind of really strong correlations of this in the equine species. So in horses, fibrosis is a big thing. There's lots of grading schemes, like we do biopsies too, just to assess fibrosis in mares as they get older. This isn't really a dog problem. Sometimes we get it reported on some of our biopsies, but it's not really a problem in dogs. I think scar tissue can be, so like scar tissue from, say, previous C-sections could impact things. Lack of rest between cycles. So if your dog cycles every 4 months, 3 months, that is going to be inhibitory for her uterus to have enough rest between those periods of times. They should have 6 months between their cycles as a minimum for optimal outcome. We're having to get really creative in the US about how to fix this, because unfortunately we no longer have access to the drugs that we used to use, and due to a lot of these drugs, a lot of these drugs are drugs that are involved in cycle manipulation that can be used for human abortion. So guess what? It means we probably will never see a lot of these drugs. You guys that are in Canada or overseas, you might have some really nice drugs that we don't have because we can't manipulate cycles without being kind of under scrutiny, or that drug companies flat out just aren't interested in having those drugs because they don't want to fight the political landscape that we are in here. But all of those types of hormonal manipulations, whether it be for progestation or trying to get things pregnant or trying to keep things from getting pregnant, they're all the same hormones that we're dealing with, just at different times and using them in different ways. So unfortunately, we're just kind of in a loss currently with how to rest dogs that are doing that. We used to use testosterone to do this. It was a derivative. It's called mibolarone or check drops. We can't get those in the U.S. anymore. If you're one of those people that's hoarding them in your basement and selling them for great amounts of money, you just let me know. Email the moderator, because we have clients that would sell their kidney to have the drug in the US right now. Sometimes we're trying, by individual FDA license, we can get a drug that's called supralorin, which is not, it forces them to cycle now in most cases, but it will make them go out of heat for a period of time. You do have to remove it because it'll last like a year or more to push a dog kind of out of heat, but it isn't legal to use in the United States in dogs unless you have a special permit. So that's basically the one that we've got that I'll use. Estrogen doesn't work very well. Progesterone will cause them to get cystic disease. Like, there's just not really a lot of good drugs that we have access to address this right now. So as far as cystic disease goes, so it's totally normal for them to get cysts. And this is a lot of the reason why a lot of older dogs can't get pregnant anymore, is because they've developed these cysts. There are certain lines, I think, that like to do this, breeds that like to do this. They're the same breeds that really like to get pyometra, and it's all considered like the same complex. So there's actually when we teach students, there is a pyometra cystic endometrial hyperplasia syndrome. It's all considered a kind of a collective, like chicken or the egg scenario, where it's all kind of a continuum. This is absolutely heritable. If we address a dog with cysts, it's absolutely a heritable thing for some dogs. We just can't differentiate if it's because they developed cysts because they had some infectious process. Infection will help produce this, right? So pyometra, if you had a history of a pyometra for a dog and you resolved it medically, she's going to be more likely to have these. She might not have them if you manage it well, but it's I would say largely heritable, really strong in my experience, golden retrievers, cavaliers, Bouviers would be another one that I've particularly had some recurrence on finding cysts and especially in like 4-year-old dog or so, and it's just not getting pregnant. It's almost always cysts in those breed for me. So this is just a really extreme version of what those cysts look like. So this is on the inside of the uterine lining on the, it's basically filleted open. Sorry, it's a little bit graphic on the left. So all of those things that look like bubbles, it looks like bubble wrap. Those are all going to stop an embryo from getting attached to blood supply, right? And there's also thought that embryos have to kind of bounce around back and forth. Well, they're going to kind of obstruct the ability of those embryos to move whenever they're moving around before they stick to the wall. And then on the right, it's the same sample. It's just to show you like there's just all these little small and bigger and smaller kind of cysts everywhere. There is blood supply in here. There's not a lot of abnormal tissue otherwise. It's just the fact that there's all these cysts everywhere is just not helping anything. We can, I don't think I have, yeah. We can address these with making, in say Australia, where you have access to testosterone, so that mibolerone drug. You can keep them out of heat, and these eventually go away because you kept them out of heat. And that's the approach of many countries that are, especially countries that do not allow or promote elective surgery for getting your dogs pregnant, that they don't do surgery for dogs in that way. In the US, we certainly do whatever we want, right? But ethically, it's a better approach not to do surgery if you don't have to do surgery. So if there's a way to do it with medicine, then we love to do that. What we tend to do, I would say, since we don't have access to that in the US, what we tend to do is you can actually go along, not in as this severe of a case, but I can go along and express cysts in surgery whenever I do a surgical insemination. These cysts will show up in droves whenever they're kind of having high estrogen. So it's usually at the same time that their cycle is going that we're going to see them pop up. An anestrus uterus, so when their uterus is quiet in between their cycles, these might completely go away. So just know they might not necessarily show up on an ultrasound that you'd be able to appreciate. This dog, you probably could see it clear as day. And your vet would probably be like, what is this when you're looking at it? Sometimes some of these pyometra cases, this is what they will look like they'll look really graphic on ultrasound to us and really clear. And then they go away and become quiescent when they're not kind of actively hormonal, but they'll come back. So it's tricky. So this inflammatory one was the other one we mentioned earlier. So there's a process called lymphocytic plasmacytic endometritis is what they'll report on our lab work. We get this diagnosis via biopsies. So endoscopic biopsies is how I like to get my biopsies. There are vets that do just like an open laparoscopic or an open, like open their midline, just like they're doing a surgical, get the uterus out, take a little sample, close it up. I have seen dogs that had that wedge biopsy kind of approach, not just the wall with the endoscope that doesn't cause a lot of damage. I've had one dog that ended up having to have a C-section, both of her puppies implanted above that scar. We did get her pregnant, but the vet that did the biopsy, by taking that biopsy, it just kind of changed the uterine shape there, and they couldn't make it down the pipes. So they went into distress, and we ended up having to take them surgically. So just know this can have negative impacts too, and just be thoughtful of those types of things. We use steroids to fix this problem. So this is it's usually 6 to 8 week descending steroid, like you would typically use a steroid for skin, say, and you start them at a higher frequency or a higher dose, and you slowly taper them down over time. We do that usually in ideal scenarios. It's dogs that have very regular cycles because we have to be able to predict when they're in season. Start them a month or so before they would cycle, or maybe 6 weeks before they would cycle. If they're a dog that's totally unpredictable, I have one in my house, this is very difficult because it's one of those things, do we keep them indefinitely on every other day if they're going to take 6 months to a year to come between their seasons, and we start her presuming she could come in at 6 months? Do we repeat the series at some point? Do we just do the 6 weeks and say like that's enough and like we'll just wait for her to come in season and she didn't come in for another 6 months? It's a tricky spot to be. And since we don't, again, we don't have a way to induce their cycles very well either because we don't have access to those drugs, and at least in the US, it can be a challenge to manage those scenarios. But I love seeing this on a biopsy because I can fix this. There's a lot of dogs that this is the reason why they weren't getting pregnant. This is the reason why maybe they had a singleton. Sometimes we do a biopsy while we're in C-section and just take a sliver of like where I did her incision for her C-section for her singleton. And sometimes this is the magic fix to what was going on. All right, so infection is another biggie. So basically, the pyometra complex is, we don't know why some of these dogs will form surface level bacterial infections that are just kind of in the tissues or just like right on the surface and just preventing fertility, versus the dogs that actually get the pyo. We don't have a way to like say why they do that, but there are kind of two different ways that bacteria like to behave in that way. It's not specific to the type of bacteria, it's just two different dynamics and situations. But if she has a history of a pyometra, I absolutely will do a uterine culture after she's done that. When she comes in season for her next cycle, after we've managed her, I want to make sure she's totally cleaned up. This is the same approach we take in horses. So it's really identical as far as how we manage these. We basically copycatted the equine industry, who does this all the time. Super easy for them to get to things, right? So they can do these for a very inexpensive cost. We have to use all of our scopes. Sometimes we have to sedate your dog because we're doing this outside of heat sometimes, right? So if they're having some scenarios, we might be culturing them like if they didn't get pregnant this cycle and you're disappointed, and we go in to get a biopsy with the TCI scope when she's at terms or would have been at term, kind of that time frame. Well, if I see some gross discharge from her cervix, I want to culture it. So we might culture something at a different stage. A lot of times, though, it's like the start of their heat cycle when we'd be testing this. The trick, though, is how quickly will we get the results? If we test them when they first come in heat, will we get the results and be able to treat her before she cycles with drugs that we can use during pregnancy also? So it can be kind of a rushed scenario. We try to get these samples out as fast as possible when we do try to do this type of testing. So I do these types of tests with both the biopsies and cultures with an endoscope. So it's just the same TCI scope that you guys are used to seeing if you do TCIs. They can have basically a uterine wash, which means we put saline into their uterus. We use the same catheters. We stick the catheter in the cervix. Usually they're awake and they're totally happy to be involved with this. Like, they don't mind. Most dogs we deal with are super used to being handled and things. And certainly, some exceptions to that, but we put in a little bit of saline and then we take it back out. Instead of putting semen in their uterus, we are putting some saline in and pulling the saline back out, and then we leave them alone. You can do a guarded vaginal swab. So guarded meaning we don't just stick a bare swab in through the vulva. We want to protect that vulvar opening. They make swabs where you can like basically pop the swab through the little shaft that it's in once it's already in the dog. So you're actually getting the sample from way up high, and then you can put that shaft back over it and then pull it back out. And that way you really get a sample that's up there. That's usually what we do for abortions or pyometras if we're doing cultures. But usually if we're doing uterine cultures, we're talking truly uterine samples. So is mycoplasma a big deal? We don't think so. But there's still some vague discussion. I think we know it's normal in the vaginal tract. We know it's normal in the vaginal tract. It's normal in the prepuce. It can be a normal cohabitant of just your flora down there. It's not supposed to be in your uterus, though. There really should not be mycoplasma in your uterus. There are other bacteria which they've actually done a study of all of the different bacteria that are commonly found in normal kind of spay tracts in healthy dogs. That was done maybe 5 or 10 years ago as a study, but mycoplasma is really not one of those. And there are a lot of people who still feel like the uterus should be sterile, but I think that study pretty much disproved that was the case. We want to use their culture results with also keeping in mind looking at their their cytology from the fluid. So we'll actually look at the sediment on the fluid that we obtain, that we cultured, and say, is it really active? Is there a whole bunch of, like, if it looks like this, their cytology, this is the sediment cytology. These are tons of white blood cells. This dog is doing something infectious. Like, even if that culture is negative, I'm going to feel inclined to use antibiotics. I hope that it comes back positive so I know which antibiotic to use. That's really what I'm trying to do. All right, we already talked about fibrosis, really a horse problem. Just trying to maximize time here. I know we're kind of creeping up on the end. Okay, so fetal loss and resorption. So we're kind of further into the cycle here. They can have similar types of losses. So these are a continuum, right? So infection could still cause loss later. We know dogs can actually have, I've seen patients with a pyometra developing on one side while they are pregnant on the other horn. It is possible to do things like that because they're kind of compartmentalized at that stage. It's tricky, but sometimes we can get those to term. But those same infections could cause, and you can get ascending infections through your cervix. You can have infections associated with things going through your bloodstream. Some dogs will have low-level uterine contractions that make we just call it uterine irritability. We'll manage some of these dogs with whelp-wise monitors, which are tocodynamometers, or little belly band systems where they will measure uterine contractions. Whelp-wise is a company that's kind of taken on the responsibility of measuring those, helping the owners and interpret them, and they basically ship you a little machine and teach you how to use it. It's a weird problem to have, but there are some lines that just know. So there's certain lines, say, of Portuguese water dogs, for example. They're like, it's super genetic in some lines, or super heritable in some lines. And it seems like they'll just keep doing it and keep doing it and keep doing it. It's like mother to daughter, like every offspring that they have, they're like, okay, well, we're just going to go ahead and go get a whelp-wise because she's probably going to be like her mom and she might need some support. Some of those dogs with the uterine contractions will end up having a low progesterone. Usually the contractions themselves, if you manage them, there's a drug that we can use that's that can kind of suppress the contractum behavior. But those contractions themselves are stimulating. Again, they're basically causing the ovaries not to want to produce as much progesterone. So over time, if you don't manage the contractions, her progesterone will also decline. Some of the times those contractions are not going to lose your pregnancy, but you might need to supplement progesterone. So that's the approach a lot of people end up taking, I think, is the progesterone supplementation route on those. They can also have fetal loss just due to illness. So certainly a traumatic experience. I've seen, a super bad dog fight. Two dogs that were, mom was taking care of them. Grandma came over to watch the dogs while the owner went to the Super Bowl, and came home, and the dogs had gotten into it. She didn't realize how bad it was, and the dog basically had bites all over its back. The pregnancy was stable for maybe 3 or 4 days. She was mid-gestation, but she lost her pregnancy. You wouldn't have known from the outside. So, like, we already knew she was pregnant at that time, but really big traumas like that can cause it. General illnesses. So, like, if you have a super high fever, say you get tick disease or heat stress scenarios, that type of thing can certainly cause it. Generalized infection, like if they had a wound that got infected or something in there, and they had bacteria kind of circulating. There's lots of things that could cause illness and then cause loss. Sometimes genetic compromise, so they just they make it to a certain stage when maybe we see them with ultrasound, they start to resorb. That is really common for chromosomal type things, DNA damage, where they'll make it pretty far, but something in the body says, this puppy was not right, and they self-manage. And it's tough because we can't tell if that's what happened. If we see more than one of them, when we start thinking infection, we start thinking like some of these other problems. But if it's just the like one-off puppy and on the end of a uterine horn, and I see something resorbing, it's not a big red flag for me. If I see a resorption, if I see like 3 of them, my eyebrows start to raise. Even if it's a large litter, I go, statistically, what are the odds that we have that many puppies that had something where they didn't want to thrive where they were? Sometimes it's benign. So things like if two puppies sit down right next to each other and somebody gets the better blood supply, well, eventually one of them is going to will out and do better. All right, I'm going to make some people cranky with this slide, but just want to say out loud that if you are a human and you go to your maternity doctor, you go to your OB and they're counseling you through your pregnancy. They tell you not to eat raw, right? They don't want you to eat a medium rare hamburger. They don't want you to go have sushi. Not everybody follows these rules, right? And in the dog world too. But in women, I think most people are like, okay, yeah, those are rules. We'll change what we currently do, and then we'll go back to it after we're done. The thing is, the same things that we caution people about in people are the same things that we kind of the same cautions or the same types of diseases that we caution people about for not feeding raw during pregnancy. I know there's plenty of scenarios and plenty of breeders that absolutely exclusively feed raw, do not feed anything else, and they have conceptions and they have pregnancies and they free whelp and everything's great. And that's great. I'm just here to tell you it is a risk factor that you are volunteering yourself for. If you have a fertility issue in a dog, I wouldn't be like just rolling the dice like this personally. I would be reining in anything I could to tie up any loose end to promote trying to get her pregnant. And the reality is, bacteria likes to go to the uterus, and bacteria floats around in your body, either from, so the other thing would be teeth, big E for teeth. I think dogs with bad mouths is like way too common in my practice, where you have a 4 or 5-year-old dog who is not getting pregnant, and you come in and she's got just horrible dental disorder. And you're throwing everything at it and spending tons of money. That's something super easy to manage that you can manage ahead of time. You can stay on top of. You can scale yourself sometimes. I mean, some owners will do their own scaling. Totally fine. We don't want to mess with their teeth while they're being bred or pregnant. And like I'll tell people to take chews away and stuff, even just because I don't want that dental tartar to liberate into the bloodstream. Just like I don't want people to be feeding anything that's going to promote potentially bacterial challenge. Our immune system is different. When we are pregnant, we are immune suppressed on purpose because the body is trying not to reject its own offspring, because it's not its own, it's not itself. It's produced something that's not its own DNA only. And so that's why they are more susceptible to infection during pregnancy. Okay, so I know I'm pushing over time now. I have some more. I don't know. Let me pop out really quick and see where I'm at. I have some more. I don't know if you guys would like me to go ahead and run through a little bit longer. I've probably got another 15 minutes or so. Sorry, I've been a little bit chatty here. What do you guys think? Moderators, do you want me to keep going?
Yeah, feel free.
Okay. All right. So just to like drive that point home, so these are the vessels. So this is a uterus. You can see my hand for perspective on the back. This is I think this was, can't remember which breed this was, but this is a uterine vessel that the arrows are pointing to. They're absolutely terrifying, right? Like they're bigger than a pencil, those guys. That is going to be, if you have circulation of any kind of particles, bacterial, fungal, etc., it will preferentially end up in your uterus because there's so much blood flow. This is the most vascular thing that your body can do as a female. There's estimated some of these dogs have 1/3 of their blood volume will be in their uterus. So if we are asking them to be a little bit immune suppressed because they're pregnant, because they're diestrous, and then we challenge them a little bit with something that they can typically handle, it just can, sometimes it can be a recipe for loss. All right, so we already talked a little bit about whelp-wise, so we'll go ahead and skip this. But this is what the old monitor used to look like. This is a really dated picture. I think I pulled it from their website. But some of these, like this is a litter that I managed in California maybe 10 years ago. That was an example of success with that. It was a dog that she had some uterine kind of contractile issues, and she was struggling to carry, if memory serves, and we were able to control her contractions or her progesterone, etc., and carry her litter to term, which was wonderful. So with low progesterone, so some of it is that negative feedback where we expect if the uterus is mad, it's going to tell the ovaries. The uterus gets mad whenever they're term, right? And that's what makes progesterone go down. So like you have all these little hormones and triggers that if your uterus is inflamed or causing some change, it's going to send some hormonal feedback to your ovaries that says stop working as well, make less progesterone. So if that is happening before they are closer to term, it's happening chronically a little bit as they go through their pregnancy, which is why the curve kind of goes down. But if it happens kind of suddenly, their progesterone can drop due to almost anything that is causing their kind of irritation or issue internally. So we'll often see that if we have an abortion with an infection, if we have a dog that has trauma, or all these types of things that can affect how your body is working. But there's also this complex that people argue about. We don't know if it's really true. We call it hypoluteoidism. It basically means that genetically you are not producing progesterone for as long as you should, and it has nothing to do with anything else going on. I think a lot of these are irritable uteruses that are mad, and that's what we say they are because we didn't know the uterus was contracting with a Whelpwise monitor or something to that effect, and we didn't manage it. But we were able to overcome with progesterone. The other scenario, which I'll just mention, is Cavaliers like to have due dates that are shorter. They like to go into labor earlier. Again, it's a little bit of a discussion point from a mentor that's quite respected of mine, who's like literally written textbooks over similar topics. She is super convinced that this breed has been selected for and survived premature births, but they are normal gestationally. They do not truly have a shorter gestation length. They are still dogs in every other way. But Cavaliers tend, like if we have a Cavalier that we're planning an elective C-section for, I might check her -4 from her due date, which is way earlier than I might check another dog. But there are a lot of them that go into labor by the time they're 4 days minus their due date. Some of the times those super early births, a lot of times it's larger litters, but sometimes we see prematurity evidence and we see loss. So we see some puppies that just don't survive, especially in like a free whelp scenario when they're really early, but they do tend to make up the other, they make up their own rules. I don't know that we really understand Cavaliers completely on that note, but it's a debate. There are other boarded theriogenologists who breed Cavaliers who say, no, they definitely have a shorter due date or the shorter gestation, and I don't believe that. So I think it's debated. So just a mention on a cool case, not a cool case for the dog, but weird systemic things can happen. So I had a case where a foxtail, I didn't know it, but I basically had a dog that was pregnant at 4 weeks gestation. We ultrasounded her. 5 weeks, she came back, was at the hospital, was fine, but he was like, yeah, she's not eating as well. And we're like, well, she's pregnant. So like it tracks, it's fine. Like I'm not super worried about it. And it kept progressing, and she's harder to feed and she's not eating well. And then she started getting real sick and she had a fever and she ended up at the ER. And then she started losing her mobility in her hind end. And then she got to about 8 weeks gestation. She's basically paralyzed. We had no idea what was going on. We almost we were trying to decide maybe we should spay her. Maybe she's having some bizarro reaction to herself and her pregnancy, or something related to the pregnancy is slowly killing this dog. Well, it turns out she had a foxtail that migrated all the way up her spine during pregnancy. So this is like a grass on. Basically, it just burrows into your skin and wreaks havoc. You guys that live on the West Coast and so, some other areas of the U.S. Are very familiar with how dangerous these can be. But there's some amazing stuff this pregnancy, the dog died, the pregnancy lasted to 8 weeks and still hung on. So like sometimes you can have massive disease and still the pregnancy is really tough sometimes. Other times it'll just be real sensitive and we'll lose puppies quickly after having something systemic happen to a dog. And just to mention on thyroid, that it is linked as an association. So there are lots of people who feel that thyroid is a magic cure. It's one of those things. I think we over-diagnosed thyroid before we did really good thyroid panels, because a lot of dogs are what people will say low normal, or they're hot, like they're, zero point 0.8, zero point 0.9 isn't one between 1 and 4 on the IDEX scale, right? Or what have you. I mean, a similar lab. I'm not sure what IDEX's specific scale is, but the almost all dogs are slightly lower than 1. Um, some breeds, it's 100% of their breed will be like that. And unless you send out a really thorough panel, you won't necessarily see that. I think thyroid disease, so there's a lot of people who feel like thyroid disease is the flag that indicates something else is happening, but the thyroid disease itself is not actually causing the problem. But in the same token, there are scenarios with resorptions. Some practitioners have suggested some really positive response to using thyroid when we see resorptions, especially recurrently. Like if we have a litter that resorbs and was a surprise, and we come back and we're shocked because she's resorbing everything. The next cycle, if she starts to do that again, that we throw them on thyroid sometimes in that scenario. I think prophylactically just putting them on thyroid, I would say clinically, we don't see a lot of difference. Usually the owners that are changing that are also changing 100 other things to try to get their dog pregnant, right? So I'm not convinced that it's the actual thyroid tabs that are doing that. All right, so I think we kind of talked about that. So just to review, so if I have an infertile dog, quoted unfertile dog, we'll go over, just like we've talked about, breeding history. We'll talk about what we want to count as real evidence of she did not get pregnant. Were they proven stud dogs? Did we have good data? Were we able to really document everything all the way through? Sometimes the answer is no, in which case I just don't count those against her. For some owners, it's just expense. And the thing is all these tests are very easy to perform. So these like uterine cultures and biopsies and things, they're done at specific time points, but they're just very expensive to do in dogs. So like in a mare and a horse, we don't have to use a scope. We don't have to have that equipment. We don't have to sterilize it. We can quite literally get a culture sample in 30 seconds and prep a mare with, with a cleaning solution, use a sterile glove and a sterile pipette system, and get the exact same sample quality of what we would get in a dog with extensive measures. So it's just a really challenging species size-wise for us to get there, to get those samples out. But if the money is there, I hate to say it like that, but if the money's there and it's not, this is really important and we don't care what it costs and we want to do everything that we can for this cycle, even if she's missed one time or maybe she's missed multiple times, but you feel confident on your end that you really did everything right, even if there's some holes in the story. There's nothing wrong with doing them. There's nothing wrong with doing these on a dog that's never been bred. It's just very expensive to do. My rule is usually if they have one strike, meaning one breeding that I feel like they really did everything right and she didn't get pregnant and she should have been pregnant, it could have been chance, right? Especially frozen, right? Like I don't knock anybody that's missed with frozen. I mean, sometimes it's just the handling error, the frozen, any number of things. 2 strikes with really good effort, especially with fresh semen or chilled semen, I think that that's totally reasonable to approach tests. Other people might just continue to breed, pick a different stud dog, try a different scenario, but I think it's reasonable to do so. Okay, let me go ahead. I think we're gonna just call it there. I had a little bit, like I said, on like body condition score and management at home, but I think that's pretty well the end of things. So basically, in conclusion, there's lots of different problems that can happen. I would say, the big 3, again, are infectious. We do see some dogs that have inflammatory conditions and some dogs that we can manage their cysts if it's all on her side. It just, if it's something treatable, great. If we run all those tests and we don't get an outcome, and that's the toughest situation to be in. Sometimes we do that, and unfortunately, we don't always get an answer. But I think, the testing is out there. It's a little bit tricky to find. And so I think, the thing to mention is that a lot of these services, it's not, even if you have a really good reproductive veterinarian, they might not be comfortable doing uterine biopsies or uterine intrauterine testing, and that's okay. I think you can always ask them and explore would they be willing to try. or consider traveling. Some of these things, it's a test. Your vet could then go forward and do the breeding management, even if somebody else was doing the testing for you. Universities in general, I think, are going to be a good option for this. A lot of them have endoscopy and are very comfortable. Not all universities have a small animal theorio program, so it depends on where you are, but they're definitely going to have the resources and connections to be able to get the information of how to do this if they haven't. Um, but if you're trying to find this type of approach and service, right now, I don't practice anywhere where I have a scope right now consistently. So I recommend I can consult with your case in theory, like if you had some questions about a dog that you have. But McKinney Animal Hospital, if you're in North Texas and Oklahoma area, Dr. Cohen is at McKinney. I think she's opening a practice end of year, but she'll be right around the same area. But right now she's at McKinney Animal Hospital, which is where she can do this testing. I can also help kind of connect you if you guys aren't familiar with that practice, or you're kind of not sure if that's the right direction to go. I'm more than happy to help direct you if you want to reach out to me at the AMC in Richardson. So that's all I have. I'm sorry I ran over quite a bit there, but if anybody has some questions, I know we probably have some that were already submitted. Maybe you already answered a few, but that's what I got for you.
Thank you so much, Dr. Hesser. That was fantastic. You
Yeah,
did answer the vast majority of them, so we'll keep
cool.
it to one, especially I know we had the technical difficulties and just timing wise here.
Yeah.
Do you feel if dogs are collected too often, it can weaken their semen?
Ooh, great question. So it's funny. I would say most people would argue the opposite, right? Like, gotta clean them out because it's not new sperm. I think it is not a problem if they're collected regularly. The problem is if you collect them frequently enough, they don't produce enough cells. So if you're not doing sperm counts on things, or if you have a smaller breed dog, breeding frequently, absolutely. Like if you had a toy breed dog and he was supposed to service 2 different girls that week, it might be really challenging to do that if he's being bred to them more than once, say, or even if he's being bred once and he just doesn't recover as much with his counts. Some dogs, I think older dogs especially, will take some time to kind of build back up from their numbers, but most of them can handle being bred with frequency. I don't see it on we have some dogs where we collect them really, really tightly timeline for things like freezing semen when they're, say they're exporting a dog that they own and they're trying to push to get things done in a short timeline, and we collect them, they board for a week and we collect them like several times. I've never observed a decline in kind of the quality of the semen, because if you think too, remember that semen takes 2 months to make. So like he can't make more that's not as good. He's just not gonna have anything there that's matured to a point where it's at that stage of being able to be ejaculated.
Great. Thank you. Yeah, well, we'll end there. Thank you all so much
Okay.
for joining us today. If you aren't a member of our community yet, please apply to join at www.gooddog.com/join so you can stay up to date on all of our future webinars and exclusive events. We do have a sneak peek for you for our next webinar, Understanding Pet Food Regulations and Labels with Dr. Martha Klein. That'll be Wednesday, July 9th at 1 p.m. Eastern Time. Yeah, we look forward to seeing you all then. Thanks so much again, Dr. Hesser.
Thank you guys. Have a good rest of your day.